Good evening. Tonight is going to be the first in a series that I'm going to do on different eye problems that diabetics can experience. Several of you have commented that you'd like to see me discuss those things since that is my specialty. For the past 39 years, I've been involved in eye care. I'm a doctor of optometry, and now since I've experienced diabetes for myself, I have an even greater passion for the issues of problems that diabetics can face with their eyes and their vision. And one comment that I wanted to address tonight, Mary Johnson says that she is pre-diabetic and that in the mornings she has trouble focusing her eyes, and she wants to know if she gets her blood glucose under control better, will that problem improve? Will her vision improve? And while I've never seen Mary Johnson as a patient personally and can't speak to the specifics of any vision problems she has, my answer is yes. I believe that it can if the problem you're having is what I think it is. Your vision could benefit greatly from getting your blood glucose under control. And the reason I say that is that diabetics early on, and you said you're pre-diabetic, early on, diabetics experience a problem where the lens in the eye, and I'm going to show a poster from my office showing you the specific part of the eye that I'm talking about here. But early on, one of the early signs that, or the early symptoms that diabetics will notice, particularly related to their vision, is this kind of sudden change in an inability to focus the eyes. And this is caused by, there's a lens in the eye, and I'm going to show you again a diagram here in a minute, but there's a lens inside the eye that changes shape. There's a circular muscle that makes that lens change shape to focus from one distance to another. And the shape of that lens determines how well the eye focuses. If you can picture a camera that's kind of an autofocus camera, that's kind of the way the eye is designed. But with diabetics, the osmotic gradient across that lens has changed, and due to the high blood sugar, and it causes that lens in the eye to swell. And when that lens is swollen, it has a totally different focusing capability, a totally different focal length than what it had prior to the swelling. And that swelling will cause your vision to seem blurry. It's one of the things that tips us off that someone, when an adult comes into our office and complains that they suddenly can't see with glasses that they got a year ago or less than a year, that their vision seems drastically different than it did a year ago or 6 months ago or whenever they got their most recent glasses. If those glasses are no longer working, and then we examine their eyes, and the prescription that they would need for glasses is a pretty sizable difference from what they had a year ago, even 2 years ago. An adult shouldn't have a huge many adults will have small changes in their prescription from one exam to the next, but most adults don't have a huge change. Now, teenagers, it's a whole different ball game. Teenagers will come in and every year, and a 13-year-old might have this huge shift in their vision, but they've also had a huge shift in their shoe size and in their height, and their whole body is changing quickly. But that's unusual for an adult to have that kind of a drastic change in their vision. And it's always a red flag for us that this person might be diabetic. It's not 100%, confirmation that the person is diabetic. They would need to go get blood tests and everything, an A1C ideally, and determine if they're diabetic or not. But it's always a red flag for us when an adult comes in with a sudden change in their vision. And it sounds kind of like that's what Mary Johnson is describing in her comment, is that she's, number one, been diagnosed as pre-diabetic, and she wakes up in the morning with a difference. It's not like it used to be. It's harder for her to focus than it was before. That's kind of a red flag to me. One positive sign, and this is true for a lot of eye problems, is if the problem you're noticing is not constant, but it's transient, that's a good sign. Many very serious eye problems are not transient. If you notice a change in your vision, like say you have a dark spot in your peripheral vision and it comes and goes, that's not as serious as a dark spot in your peripheral vision that is constant and never goes away. That's a sign of a retinal problem. Something that comes and goes usually kind of drifts through your vision, little specks and spots. We call those floaters, and that's not serious normally. But my point is, anything that's transient that comes and goes is not as serious as something that's permanent. And what Mary describes is that it's only in the mornings when she first gets up that she has trouble focusing her eyes. And to me, that's a positive. And the fact that she's been recently diagnosed as pre-diabetic leads me to believe that she probably, I can't say 100%, but she probably has this swelling in the lens of the eye. And I want to show you a diagram of what I'm talking about here. This is a poster that I have in each of my exam rooms that gives the anatomy of the eye. And I show this to patients to describe quite often what's going on with their eyes. And the lens that I'm talking about is right here. This is the cornea. The very front surface of the eye is called the cornea. Right behind that is the iris. That's where your eye color comes from. If you're brown-eyed, or I'm blue-eyed, as you can see, that's the iris determines your eye color. And that's circular, of course. When you look at somebody's eye, the pupil, it looks like a dark spot. That's an opening in the iris. But the structure that sits right behind the iris is the lens. We call it the crystalline lens. And when you're young, it's real flexible. It'll change shape to focus from one distance to another and focus light on your retina in the back of the eye back here. And it's that lens with diabetics that begins to take on fluid, and it makes it fatter. It makes it swell and become fatter than what you see right here. And that changes the focusing power of the lens and makes it where your eyes seem like they're out of focus. And that is one of the early changes that diabetics will see. Sometimes that's the first symptom that people are really aware of that they're having an eye problem, is the fact that their vision seems weird. And a lot of them who don't know they're diabetics yet. Now, I see diabetics every day in my office, and probably 98% of them already know that they're diabetic. In fact, in many cases, their doctor has referred them to me. The doctor that's treating them for diabetes has referred them to me to get an eye exam to see if they have any more serious. There are more serious problems that a diabetic can have with their eyes, and we'll go into those more serious problems in future videos. But that their doctor that's treating them for diabetes sends them in for an eye exam every year, and that needs to be a dilated exam where we dilate the pupil so that we can see into the retina much more thoroughly than we can without dilating. And in our office, we have a digital camera where we take big digital photographs of the retina to see if there's serious problems going on inside the eye. And we have other tests that we do too. The OCT is a very powerful device that in diagnosing retinal problems as well. But we take digital photos on every diabetic every year. And but anyway, this initial symptom of blurry vision, like I said, probably 97, 98% of the diabetics that I see on a daily basis, I see diabetics every day in my office. But again, the majority of them already know that they're diabetic. They're coming in to see if there's serious complications with their eyes. For that other percentage, that 2 or 3% that don't even know that they're diabetic yet, many times they come in thinking, I just need new glasses. And there've been so many times over the years that I've told them, well, I think there's something more going on with your eyes than just needing new glasses. Have you had your blood sugar checked lately? In particular, if you had an A1C, a hemoglobin A1C, and I'll write that down for them, say, if you haven't had this test done, I'm going to write down the name of the test you need. You need a hemoglobin A1C. Go to your primary care doc and ask to have this test run, because I'm seeing changes in your vision that indicate that you might be diabetic. So I strongly recommend that you go and get your blood tested. And that's more important than getting a new pair of glasses for right now. For one thing, if your blood sugar's out of control, trying to get new glasses is like chasing a roller coaster. For us to try to come up with an accurate prescription for eyeglasses is literally like chasing a roller coaster. I could examine you when your blood sugar's up here and come up with one prescription, and then a few days later when you pick up your glasses, your blood sugar may have dropped down here, and those glasses seem worthless all of a sudden. And it is literally like chasing a roller coaster trying to pin down a good prescription for eyeglasses on a diabetic patient. And so anyway, we're going to be discussing in the next few videos, I'm going to do a whole series here discussing different problems that we look for with diabetics. We look for diabetic retinopathy. We look for macular edema that diabetics sometimes experience. We look for cataracts and for glaucoma. There's all sorts of problems that we need to look for with every patient, but also particularly with diabetics, because diabetics are much more vulnerable to these sorts of problems. And another problem that causes blurry vision for adults over about age 43 is called presbyopia, but that's a very normal thing, even non-diabetic. Everybody goes through that. That's where you get your first bifocal, or for people who've never had glasses, sometimes they're getting their very first pair of glasses, but that's very normal, and that happens to people who aren't diabetics. But these are all the kind of things that we need to look for and rule out when an adult over the age of 40 comes in complaining of sudden vision changes. We need to look at all these different issues, but it is very common to have this swelling of the lens that I talked about before for somebody who's real new to diabetes. That swelling of the lens that causes a big change in the focal length of their eye, or the focal power of the lens in their eye, is very common. And the good news about that, unlike some of the more complicated problems you can have, is it is reversible by getting your blood sugar under control. So this is part one. This is number one in a series of videos I'll do on diabetic eye problems. Thank you. And remember, live healthy, finish strong.